Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're going to learn about how the government and healthcare companies are now working together to make people suffering from hearing loss have an easier time getting the help that they may need. The FDA recently approved over-the-counter hearing aids that are now available at pharmacies and stores nationwide. Our guest today, Janice Trent, is the director of the American Speech Language Hearing Association, Vice President of Audiology Practice. And we're going to speak about this new innovative product that's going to be a life changer. So Janice, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Can you introduce yourself and tell people how you got so involved? I mean, you are really involved in working with people that have a hearing loss and making their lives better.
Joan, thank you so much for your invitation. As you said, my name is Dr. Janice Trent. I am the Vice President of Audiology Practice for the American Speech Language and Hearing Association. Honestly, I've been an audiologist for over 30 years and have worked extensively with individuals with hearing loss. And certainly over that time period, we've seen a lot of changes in hearing aids, but we've also seen a huge increase in the number of individuals who have hearing loss. So now we're somewhere in the neighborhood between 38 and 48 million Americans with hearing loss. And yet only about a little over 30% of individuals with hearing loss actually wear hearing aids. So we welcome this new category of over-the-counter hearing aids from the FDA because we feel that it is going to be a wonderful opportunity for individuals who have been sitting on the line to try amplification, possibly in a more private environment if they're afraid to go to an audiologist. But hopefully this will open the door so that many, many more people will try to do something about their hearing loss.
It sounds like you're working on reducing the stigma of hearing loss, whether people associate it with aging or some sort of flaw. I was even thinking when I was looking through, the website for your association that my husband, we're getting older, and my husband's starting to do this when he talks to people, and I'm like, oh my God. But he would be the perfect person to approach this product because it's, like you said, private. It's not announcing to the world that I have a hearing loss. It's kind of could be done between you and, say, your pharmacy, your local pharmacist. Is that what you're seeing, that it's people that have hesitated to admit that there's a hearing loss going on? Like when they come to you, what do they say? Like, I think I have a hearing loss. I know I have a hearing loss.
Well, honestly, the husbands that come to me always say, my wife says I have a hearing loss, okay? So they never want to admit that they have a hearing loss. And so I always try to approach that gently. So, I'll say, well, let's just see. Maybe it's just wax in your ears. And they'll say, yeah, that's right. And of course, when I do otoscopy and the ear canals are clear and I have a video otoscope so they can kind of look down the ears as I'm looking, then they're kind of disappointed. But that kind of breaks the ground and it says, okay, so now we're going to do the hearing test and we're going to see what's going on. And then they kind of say, all right. So when I come back into the sound booth and I say, well, your wife might have been right. They're not totally surprised. And then we can go into the conversation. And I really hope that people like your husband will not actually go to the over-the-counter model first. And let me just be honest. As an audiologist, I feel that hearing loss is one of those disorders that it's invisible and we don't talk about it enough, nor do we have enough of our physicians making sure that they screen individuals with hearing loss. So people are out there kind of floundering, not knowing what to do. And there is a procedure, there is a model for everyone. And that should be to go and see a licensed audiologist. I am representing the American Speech Language Hearing Association. We have over 233,000 members in our association, and we represent speech language pathologists, audiologists, scientists, researchers. And for audiologists, our primary goal is to provide person-centered care in the prevention, diagnosis, and treatment of hearing and balance disorders. So we are well equipped to help you and also to be sensitive to concerns. So for those people who are, I really don't want anybody to see that I have a hearing loss, there are over-the-counter hearing aids that are custom, that are quite invisible. So if I could make a comparison, the over-the-counter hearing aids are great, but they are going to be non-custom, which means they are going to be visible, probably hanging over the ear.
Are they similar to, and it really is the same thing as getting glasses? I mean, how many people you see doing this before they actually go get their eyes checked? And then if you go to a pharmacy or certain stores, you see a range of glasses with certain prescription lenses, or not prescription lenses, but certain lenses that kind of magnify their reading, and we call them reading glasses. Is this going to be really kind of the same thing? Like, you still need to see an optometrist, we know that, but in the beginning of the hearing loss, do you see people looking for something like this, where it's got a set price? I mean, I think I read it's like less than $1,000 for the most part, and that excludes the audiologist. So this is still a cost. But is that how you see this being used? Kind of like those readers that I see in CVS? And
I think I would make the comparison of contact lenses. Okay.
Oh.
Because, you have a little difficulty with vision. But, we want to be careful about how far these things go in your ears, although the FDA has made provisions about the depth of all the devices. But I really think that when we're really talking about what's the right step, this is not the same as just over-the-counter hearing aids. And over-the-counter reading glasses.
Okay.
With reading glasses in general, you put them on and you keep moving. And if you need a stronger power, you go get another one. This is even at less than $1,000, it is still a major investment. Mm-hmm. So, if you're going to get it, you want to make sure that what you're getting is the right thing for you. And so these are only intended for adults 18 years and older. They're only for individuals with a mild to moderate hearing loss. And they're definitely not intended. They are not for children. And so those things have to be taken into consideration. With the over-the-counter hearing devices, you do not have to take a hearing test. You're right. All you do is kind of fill out a questionnaire. And based on your answers, they'll determine whether or not you have a mild to moderate hearing loss. Now, we know that for the young adults, they are usually going to overestimate their hearing loss. For the older adults, they're usually going to underestimate their hearing loss. So we really want to make sure that your first step should be to get a hearing test. And if you think about it, when you go to the doctor, they screen you for your blood pressure. They listen to your heart. They look in your eyes, and they should be testing your hearing. Most of the time, they're not. But a hearing screening should be required. And so with that in mind, I'm just not clear why people would be really comfortable with just doing a self-assessment. This is one of the third most chronic illnesses going around in the United States. So why wouldn't you go ahead and check to find out what kind of hearing loss you have? For some people, they're going to be told, this thing is so mild, unless you're really having trouble communicating, thereby indicating that the hearing loss has become handicapping for you. Then you might want to do something. But, if you have a mild to moderate hearing loss, you still want to find out what kind it is. Not to get into too much detail, but you can have a different shape audiogram. So it can be mild to moderate, or it could be moderate to mild, meaning that you have poor hearing in the low frequencies, but your hearing gets better in the high frequencies. Well, if you get a hearing aid, and it's amplifying less in the lows and more in the highs, it's not helping you. And so that's why you want to make sure that you first are seeing a licensed certified audiologist, getting a thorough hearing evaluation. And if it is your intent to get an over-the-counter hearing aid, that is perfectly okay. You can consult with the audiologist, and they can send you off and direct you in the appropriate direction. And so that's really, really critical.
Let me tell you, you're bringing a lot of questions to my mind. But first,
oh, really? Okay.
Yeah,
well, we got time, so we can talk about it.
I guess I'm getting older, right? So I'm thinking now, what are my plans? You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're learning about the new over-the-counter hearing aids that are now available in pharmacies and stores nationwide. Our guest is Janice Trent, American Speech-Language Hearing Association Vice President of Audiology Practice. That's a big mouthful, but this is a really important topic. And I think, Janice, before this little identification, you started talking about needing to really have a thorough exam before you invest that money, because it is still money on an over-the-counter hearing aid, because there are so many things that could be going on that give you the impression that you're losing your hearing, and maybe it's something that could be fixed. You mentioned earwax.
Correct.
But what are some of the other symptoms of actual hearing loss that people come into you and tell you is happening?
Well, sometimes it's an ear infection, and sometimes it's related to sinuses that are draining. And in all fairness, the FDA does have those precautions listed on the outside of the package, I believe, that tells you that if you have running in your ears, if you have pus in your ears, if you've noticed a change in your hearing in the past 90 days, that the over-the-counter hearing aid is not for you. I just hope that everybody reads all of the writing before they just purchase the device. And so in many cases, and there's a very, very small percentage of people that actually have possibly a tumor. And in that case, we've got to send them off to a physician right away. It is very, very tiny, so I'm not going to, push that too much. But the issue is that there are many different kinds of hearing losses that you can have. And so the first step, rather than just assuming, oh, this is a basic hearing loss, I'll just go put a pair of hearing aids on. The first thing is to get a full audiological evaluation with a certified audiologist, so you know what you have. I mean, in this day and age, everyone should be an intelligent consumer. Have no trouble with you going to get the over-the-counter hearing aid if that's right for you. But first, make sure that you know all your data about yourself before you move forward.
We have a huge disparity in healthcare and the availability of all sorts of medical treatments and even assessments. So is there something through your organization that actually points people into a direction where they can get an audiology workup prior to being on their own and going into a pharmacy that is affordable or reduced is what I'm saying, reduced cost?
For starters, most of the time, hearing screening is either low cost or free in most facilities, okay? But for your listeners, they can go to www.asha.org/ProFind. That's short for professional find. And just enter their zip code, and they can find a certified audiologist in their area.
That's great. And you mentioned that it wasn't for children yet, or is it a yet, or is it just not for children?
I don't think it's ever going to be for children. Yeah. There are so many other variables that we have to be consider when we're looking at children that I think children will always be a protected group.
Now, the one thing I know that people are consumers, if they don't work, what is the recourse for someone that purchases them? Is there this is my problem, kind of a signature where they assign away the manufacturer having to guarantee them good hearing? Or how does it work if a person's not satisfied with it? Are they able to return them? Because that still is a big investment.
You're absolutely right. And the FDA did not mandate that they be returnable. So you have to read the label to find out whether the device that you purchase is something that you can return. And that's real critical because heaven forbid you get, I don't care whether it's $300. That's still your money. And to purchase something that doesn't provide the benefit that you expect is unfair, is inappropriate. So first, by all means, as you're looking at the packaging, number one, you want to make sure that the device is a device that has been FDA approved. You also want to make sure that the device is returnable. If it is not, think about it, because this is really critical. And it does take time to get adjusted to a hearing aid. And that's also my concern, because I dispense hearing aids, but I see almost all of my patients 2 or 3 times in the first month that they, get a hearing aid, because adjustment is not easy. And so, I don't turn the hearing aid all the way up, and I do some counseling. And, they'll come back and they'll say, I was listening to this sound and it was too harsh. And for me, I can go into the prescriptive hearing aids and make adjustments for them that meets their comfort level. Hearing loss is not like a one-size-fit-all situation. And so many people have different preferences, to what they like to listen to. And so it is the hearing professional who knows how to hear those concerns and actually knows exactly how to go in and program and adjust the hearing aid to accommodate for those concerns.
Do you find people come in to consult with an audiologist before they try the lower cost or over-the-counter hearing aid? Because it sounds like it may not even be worth the money if it's not going to give you quality hearing. Like, as you said, you can adjust the ones that are prescribed, but these don't have that same ability. So do you really recommend, I just want to make sure that everyone in the audience knows, you just don't go in and buy it. Like, really, this is, it's like buying a car. You really have to make sure this one fits your needs.
Right. You want to kick tires.
Yeah. You want to kick the tires.
But you do. You really do want to make sure that the device is right for you. And that's why I said you want to see an audiology first before you do it. And let me say, I know the assumption is that all hearing aids are super expensive, several thousands of dollars. And that's really not the case at all. There are many hearing aids. I will admit to you that they're going to be more than the over-the-counter hearing aids, but many of them are not, thousands and thousands and thousands of dollars. That's just not it. Also, many insurance companies do cover a substantial amount of the hearing aid. So patients can actually get a really good prescriptive hearing aid and do extremely well. It's not going to be the most expensive one, but it's going to be a solid hearing aid that's going to include audiological services and follow-up care so that we can ensure that the patient is doing well.
I was looking on your website, trying to get familiar and comfortable, with you coming in today. And I saw a question on it that I was like, oh my gosh, I would never have thought about this. Is it Bluetooth compatible? And then we're talking about the over-the-counter, but do they make hearing aids that are over-the-counter or prescription that actually can work with the phone? That was one of the questions on your site.
Yes. So I really don't know what's coming out with the OTCs. I know, the technology that we were requesting, and I know that they've complied with that. But the prescriptive hearing aids come with Bluetooth technology. I think 100% of the hearing aids that I'm fitting, except for the really small custom hearing aids, are all Bluetooth compatible. And folks love them because they connect directly to their cell phone. They can listen to books on tape. They can listen to music. Many times you can connect them to your tablet. So some of the latest technology, you can actually connect to 2 Bluetooth devices from your hearing aid. Some of the new devices have health issues, heart monitors, so that you can actually, count your steps, that kind of thing. So the prescriptive hearing aids are fantastic technology, and they all don't necessarily break the bank. Okay, you can really get some really good ones, but for the over-the-counter hearing aids, we're just trying to make sure that people are able to hear. Mm-hmm. And if you want something affordable and accessible, then it's the over-the-counter hearing aid that you want to get, recognizing that there's a lot of great technology within the prescriptive line. I
really like the idea that you're encouraging the audiologist as your first stop for the over-the-counter or prescriptive devices. I think that's really, really key. You're listening to Your Family's Health on the Voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the Nursing Department here at Nassau Community College, and today you're learning about the pros and cons of over-the-counter hearing aids that are now available at pharmacies and stores nationwide. Our guest, Janice Trent, is the Vice President of Audiology Practice, and she's also part of the American Speech Language Hearing Association. So now, Janice, if you had to tell people, like they approach you when their wife says, she's not hearing them, right? Or I see my husband doing this in public and it's getting kind of annoying. And he does have ear issues. So he does have someone watching his hearing as well. But not everybody does. And you gave us a great website to go to just to find out where in your area. So if you had to give our listening audience now a real step-by-step process when they feel that they have a hearing loss, how would you start it with them? Obviously, they come to you. And the first question you ask them is what? What is the first thing that you ask and want to know about their lifestyle?
Well, the first thing I always ask is, what brings you into my office today? Because invariably, there has been something that's happened in their life that has told them, I need to go do something about this. So that's where I start first. What has happened? Oftentimes it's the spouse saying for the last time, go do something about this, okay? Sometimes it's as gentle as a grandchild that has said something to them and they just missed it and they just feel so badly. But let me get to the other spectrum. You're at Nassau Community College. Sometimes we have students who are not hearing what's going on in the classroom. And they're not hearing the dialogue with their classmates. They may be struggling hearing the professor. And of course, if they're younger, they really are embarrassed. So oftentimes they're coming in saying, this is affecting my academics. This is affecting, my job opportunities. What can I do about this? Okay. So probably the first thing I do, and one of the things that I always think is important for people to understand is that I told you I've been doing this a long time. I've got a doctorate. I've got a whole lot of education behind it. But one of the things that we as audiologists are concerned with is providing person-centered care. And so what that means is we want to meet the individual as they come through the door and find out what it is that's of concern for them. And in doing that, then we can take off from there. And many times people will tell me, I don't want this thing to show. I know I have a hearing loss, but it's got to be invisible. So that kind of tells me exactly where we're going. So I'm going to do a comprehensive hearing eval. And the comprehensive hearing evaluation, generally done in a sound booth, they're going to repeat some words back to me that are super soft. I want to see the softest level they can hear. Then they're going to do the old fashioned, when you hear the button, when you hear the beep, press the button. Then we're going to do some other words that are said at a comfortable level. And we may do some words with background noise to see how well they're managing background noise. And then I may do something to assess just to make sure that their middle ear system is clear. I want to make sure that they don't have an ear infection. And so once I've done what we call the comprehensive hearing evaluation, then I can sit down and really talk to them and essentially map out a hearing healthcare plan for them, meeting their needs. This is person-centered, so it's just not me telling them what I think they need to do. It is the patient or the consumer in dialogue with the audiologist to discuss the concerns that they have in light of the information that I've given them. So now we have this educated consumer because I've done what I was supposed to do, and I present them the information. And then we start talking about their options, and we start talking about what is of major concern for them. And then we move on from there. So in your husband's case, maybe he doesn't want to have a hearing aid that hangs behind the ear. Maybe he's saying, I don't want anybody to know I have it in my ear. So then I'm going to be talking about a prescriptively fit custom in the ear hearing aid. So here I'm going to take an impression of the ear canal. I'm going to put some soft putty in the ear, make an impression, send the impression as well as the audiogram to a manufacturer, and they're going to design a custom fit hearing aid. That's a prescriptive hearing aid. The over-the-counter hearing aids are not available in prescription, in custom. They're only available in the over-the-ear type or in a device that's not, it's probably going to be a little bit more visible in the ear.
I never thought about that. So everyone's ear is as individual as they are.
Yes.
So something that's not made for them may not be comfortable. So in the long run, this is really a process that they need to think about from the first time that they identify a problem. Now,
Sure.
do you often include? I know this is probably not the truth that you need to include the complaining wife, but do you ever include other people in the discussion to try to get a better
Absolutely.
picture?
Yes, absolutely. Matter of fact, we invite significant others to the office all the time because that really helps us to get a larger picture of what's going on. And sometimes the patient, the consumer, is not as forthcoming as the significant others will be, And so we get a chance to have a healthy dialogue about what's really going on for the individual. And, and frankly, sometimes I have to talk to the significant other family. Sometimes they're talking to me and I can't hear them. And so I have to say, communication is a two-way street. And just as someone needs to hear, you also need to be able to speak clearly and articulate your words. And if, maybe some people mumble or they talk entirely too fast, and that makes it difficult for others to understand what they've said. So it gives me an opportunity to really look at the family dynamics and see what's going on, and then to address the total picture that is being presented with the patient.
I don't hear that much about hearing loss. To be honest, I don't watch that much TV. But is this something that you find just is not talked about or advertised? We see advertisements of healthcare, prescriptions, anything on the TV all the time. Everything, right? We have all these problems people have advertised. They can fix it. But you don't hear that much about hearing loss. So absolutely. I think this over-the-counter may actually bring that to the forefront. Just your conversation right now has really clarified the role of that over-the-counter hearing device.
Absolutely. As I said, I've been doing this a long time. Yeah. And my husband frequently says that when he tells people that his wife is an audiologist, even now, they will say, well, what is that? So, he's like, wow, Jan, this is, we've been doing this a long time here. So we really are welcoming this whole issue of over-the-counter hearing aids because we want to say, we're here.
Yeah.
Audiologists have been here for a long time. We started right after World War II in the VA hospitals, and our profession has just been exploding, helping individuals with hearing loss. We have the science, we have the research behind what we do. And so we're the ones that people should be coming to. So I'm welcoming this to have an opportunity to talk to your community to say, you may not be able to find me in your community, but please go find a licensed certified audiologist in your community and get a comprehensive hearing evaluation.
So, Janice, I want to thank you very much for being here today from the American Speech Language Hearing Association and Vice President of Audiology Practice. It's just been a wonderful, wonderful conversation, and I hope you stay safe and continue to stay healthy and continue to do great work that you are doing already. And I expect to see you on commercials and stuff like that. But this is Joan Buckley from the Nursing Department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.